I think there's two highlights that I have to stress on based on the study. The first highlight is that I think our study shows how we are able to combine the surgical oncologists and medical oncologists in a multidisciplinary way to do a collaborative clinical trial to improve the survivability for the osteosarcoma patients. Based on the previous study, you can see that all the studies are purely on the medical oncologist perspective, where you put a new drug on a certain patient and look at the progression-free survival. So our study really highlights the importance and the need and the potential of combining doctors, patients, surgeons from different expert from different area to come together to doing a joint clinical trial to really improve our patients' benefit and their quality of life and their survivability in this rare disease. And I guess the second highlight of our study is that we've been able to show that in the peri-operative settings, you can really have a key trick to select the TKI that you're going to use, which are not well covered in other clinical trial. In our study, we choose Apatinib, which is a highly selective tyrosine kinase inhibitor, which have a really fast absorption and washout half-lives, which is less than 9 hours, as compared to several hours, several days, or even months seen in other TKI or anti-angiogenic therapy. And that's the key to our clinical trial, because we use this fast absorption, fast washout agents that you can use in the pre-operative setting to avoid the surgical complications. If you see some potential complications, you can quickly stop the drug and do a watchful waiting, do an active surveillance, and keep a close eye on those patients and wait until the toxicity get better. And then you can reinitiate those drugs with a very fast pharmacokinetics. So I think that's a key to the field. That should be an inspiration to the field, that when you combine surgical oncology with medical oncology, the pharmacokinetics of the drug is something you should really consider to make sure that the toxicity is not too high, and we can increase the benefit of the patient to the maximum level, as well as decrease the post-surgical complication rate as much as possible. And that's the second highlight of the study, and that's all.